Hello and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin, obviously looking to increase the influence of today's engaged dentists. And I know what you're thinking, Bryan. Since you've switched podcasts from the operatory to the Patient First Podcast, you've talked about abundance, you've talked about tooth apps, you've talked about Dental Standards Institute, and all of these things that came out of the pandemic. Certainly you don't have anything new. I do have something new for you today I'm really excited about. But first, let me talk a little bit about how we got here. So fans of the podcast for a while may know that we, after the pandemic, had a big transition over here and with Upgrade Dental and transition from the operatory podcast where host with my man, David Pryor, who's still a great friend of mine. He will have to be on this one at some point, to the Patient First Podcast. We're really focused on addressing patient convenience, making our care more accessible to our patients, and how it can really just elevate the game for the engaged dentist and basically to grow your practice through being more convenient for patients. Now, that has resonated. Obviously, we're doing maybe not obviously, because you may be listening traditionally through a traditional podcast service, but we do also do YouTube. So these are video podcasts now. So I get to talk into a microphone, which is kind of ironic because when it's just me, you got to look at just me wearing the same thing every day. But hopefully it's more engaging, and it seems to be, because we're getting about 4 times the downloads with the Patient First Podcast than we did with the last download. So, and it's growing rapidly. So thank you for listening. And we've really, I think, honed in on some great content with book supply to dentistry, our key dental indicators. A key dental indicator I just read was 35% of dental offices are down a team member at the front desk. 35%. Wow. If you don't know what to do, go back and listen to some prior episodes about automating your practice. Anyway, so we're doing some timely topics at the Patient First Podcast that is really resonating. So thank you for all your comments, for your questions. I love answering your questions on podcasts. We have one coming up in a week or two that I'm really excited to talk about. But something seemed a little bit off, particularly when I was doing my interviews with some people that we've had. I think I've talked a lot, and I continue to talk and love to talk with people that speak directly to dentists that aren't dentists. And we want to bring on more dentists onto the Patient First Podcast. So if you're a dentist doing great things and you have something to share, I'd love to talk with you. Hit me up on YouTube, in the comments, on LinkedIn. You can reach out to me on Facebook. I'm easy to find. I'm out there, obviously. So if you have something you'd like to share and you're a dentist, reach out to me. I love talking with dentists, but I also love talking with people in the industry. But oftentimes, it's not a patient-first approach, right? And so I'm talking with these people sometimes doing interviews, and I'm thinking, I love talking with this person, and we're bringing value to offices. However, I need to talk to this person longer. These podcasts obviously are bite-sized, I like to call them. If you have a commute, you're probably good. Your drive, at least there and home, you could listen to one Patient First podcast. We like to keep them short, and we've had a lot of feedback that people like the bite-sized, get right to it effectiveness. But sometimes we want to expand on what we're talking about. And also, we want to talk directly about what patients are thinking. Oftentimes, I can hear the voices of all the dentists, of all the office managers, of all the DSO leaders in the back of my mind as I'm talking to a dentist, thinking, I want to ask a question that person's not answering because Laskin is being nice to his guest, right? He's trying not to ask the hard questions that everybody wants to hear. And I think that's problematic. I think that we need to ask those questions of these vendors. However, the Patient First Podcast isn't the appropriate format. And in particular, what are the questions that we want to ask? Well, we're the Patient First Podcast, the Patient First Manifesto, the book. If you don't have a copy, hit it up. You can get it for free at patientfirstbook.com. But this is all a subset of Upgrade Dental, right? Where we are really bringing the industry forward. We're showing you how to grow your practice, and we got a lot of cool stuff coming early 2022 with Upgrade Dental. So if you want to check it out, go to upgradedental.com. We've got lots of great education coming with new faculty members. Ooh, preview that are going to be doing some very unique, awesome things, not just for dentists, but for your teams. I digress. That's a future new initiative. Today we're talking about a specific one where we're going to be doing interviews for vendors where we talk the hard questions, not just hard questions, but the things that dentists would want to ask, but they can't because they're not here with me. And particularly around the upgrade, what we call the proprietary cost of implementation framework. The cost of implementation is how we filter any technology, any service to see if it's right for your practice at this time. It's an acronym. C stands for clinical quality. O stands for observations by your patients. The dollar sign or S is for ROI, and T is for team health. So I went over that fast because if you're an Upgrade Dental member, you're very familiar with their cost of implementation framework, where we talk about these are the 4 pillars that you want to run everything through. And if you want more information on how to leverage the cost framework, it's detailed out. You can learn about it for free at upgradedental.com. But it's how we leverage to anything to see if this is right for your office at this point in time. Now, if it doesn't increase clinical quality and both, so clinical quality and observations by your patients, your patient experience, if it doesn't have a resounding yes to both of those, then we move on, right? If it's not adding to clinical quality, or I should say because obviously if it's increasing the patient experience and it has no effect on clinical quality, something like online payments, right? Great for patient experience, doesn't really do anything to the quality of the care that you deliver, but has massive ROI and increases your team health. That's a 2 thumbs up. If I had a 3rd thumb, I'd put it up too. But so it can't, anything we put in our practice can't negatively affect either one of these things. So if I have on a vendor that I'm questioning, does this actually increase the quality of care, or does this increase the patient experience, and why? I'm going to go deep. I'm going to ask the questions, and I want to have more than 15 minutes possibly to really dig out of this vendor why this is going to be good for practices listening to the interview. So what does that mean? That means that we are launching a brand new initiative, an interview series called Second Opinion by Upgrade Dental. Second Opinion is we're providing the second opinion. Obviously, you can be the first opinion, but I want to ask the questions that you might not even want to ask because you're a nicer person than me. Right? You don't want to be confrontational to a vendor. And I'm not looking to be confrontational. I'm just looking to really uncover to see if there are things that we need to know if we implement things. For example, and I talk about this a lot in Upgrade Dental, if you remember, what we call the Valley of Despair. I believe I've done a podcast on the Valley of Despair, a patient first podcast. What that means is that anytime you do anything new, even if it's massively better in every single way than what you used to do, there's going to be some pain associated with implementing that service, that technology, that new procedure, that new burner that you just got, right? There's going to be some type of thinking that you have to, some calories you need to burn in your brain, some training you need to do with your team, some money you have to lay down to buy this thing, right? Some type of pain that you're going to have to go through to implement anything. And that, my friends, the salespeople don't typically tell you about, right? They don't tell you, oh, by the way, when you put these paperless forms, right, when you get them, you're going to have to put them on your website, right? And putting them on your website is going to cost you $2,000 and 12 calls because that website vendor doesn't call you back, right? It's going to be a PIA. It's going to be a PITA for you to get these forms on your website. Ooh, we've got a solution for that coming very soon, which I'll talk about in another podcast. But they don't tell you that, right? And then we sit here on the vendor side going, why aren't they using the forms? Oh, it's because they want to use them on their website, and that is a pain, which the salespeople don't tell you, right? So we ask those questions to make sure to uncover the problems, the barriers. I don't want to say problems. It's really the inertia that you have to break to get the size of the prize on the other side of that valley of despair. So most of the things that these vendors are talking about in dentistry are phenomenal for the right practice, right? For the right practice at the right time. There's not too many things that you go out and you buy and they're total duds for every, but some things are duds for some practices and they work really well in others. And we want to uncover those reasons. What makes this service, this technology, this product, right? And for whom and when, for example, if you're looking at artificial intelligence radiographs, well, and you're using film, not for you, right? But if you are using digital x-rays, you've used them for years, and you do a lot of perio in your practice, and you would like to augment that with some type of, artificial intelligence that can tell you exactly what the perio pockets are, well, that's available today, right? So, but it's not for every practice all the time. But what does it take for training? How many false positives? All of that stuff we will uncover through Second Opinion, a new interview series that's coming your way, well, right after the first of the year. So 2022, we're going to start launching Second Opinion interview series. They will be available to watch on demand, and then also they'll be within the Upgrade Dental portal. So every Upgrade Dental member will have access to all of the Second Opinion interview series whenever they want to review them. So looking forward to it. Hope you'll join us when you see one that's of interest to you. And it's coming your way early 2022. Thank you very much. Thanks for listening. Let me know what you think of the series. If you have somebody you'd like me to interview, to put to the test on Second Opinion, place it in your comments below or hit me up on LinkedIn. Bryan Laskin is my name, obviously. You can also find me on Facebook. So thank you very much and look forward to seeing you in another Patient First podcast.